Hi, my name is Dr. Jessie. I'm an integrative doctor of physical therapy at Resonant Frequency Medicine in Colorado, and I specialize in diagnosing, finding the root cause of, and treating vagus nerve dysregulation. This is an exercise that I often prescribe to patients who frequently present with upper cervical misalignment, which is actually a reflexive response of being in a chronic stress state. And this comes from Stanley Rosenberg's book, The Healing Power of the Vagus Nerve. And it's a great exercise to get in the habit of doing multiple times throughout the day if you can. So since it's so simple and it only ever takes 2 minutes or less, I tell people that it's a great habit to get into anytime you use the restroom. So anytime you go into the restroom, sit down, go ahead and initiate this exercise while you're taking care of your business. You can do it any time of day. It doesn't have to be seated. You can do this laying down, and you can also do this standing up. It's very simple, but I'm going to talk about a couple of pitfalls, so be sure to watch after I demonstrate to know what to avoid when you're practicing this exercise, especially for the first time. You place the palms or anything that gives sensory input. So it can be a scarf, it can be, if you're wearing a turtleneck, you're already set, but some type of gentle sensory input, not a lot of pressure, just sensation at the back of the neck along the occipital nerves. If you were doing this seated, you would place your hands right where the hairline meets your neck gently. So I'm not pressing, I'm just simply placing my hands here. If this is a challenging position for your shoulders, you can always simply reach back like so, or you can just grab a towel and sling it around the back of your neck and give yourself that input. So with your hands in position, you're going to look first to the right for 60 seconds or less. So you look your eyes to the right, not straining the eyes, but just in a comfortable position that's out of your myopic front-looking gaze. So you're looking to the side and you're waiting. You're just curiously, patiently waiting for a response from your nervous system that we classify as a phase shift, which is a yawn, a sigh, a swallow, or a deeper breath. So looking one direction, I start to the right. You wait for a yawn, a sigh, a swallow, or a deeper breath. Once that happens, that's your signal to go to the opposite side. So going to the left and waiting for a yawn, sigh, swallow, or deeper breath. You want it to be involuntary, like just something that arises. You can, if you get to the end of 60 seconds and it hasn't happened, you can open your mouth and just initiate a yawn. Really what we're looking for, what the aim is this automatic activation of your autonomic nervous system, that phase shift, which we classify as a yawn, sigh, swallow, or deeper breath. So some things to make sure that you're not doing. One, you don't want to press really hard on the neck. That's just not necessary, and sometimes it can cause extra strain on the neck itself. So really, it's just the lightest touch at the back of the neck. The next thing that's really important, this is not what you think of when you think of an exercise. It's not a stretch. So our goal isn't to stretch the eyes as far as we can in one direction. In fact, it's the opposite. We want to go outside of where we spend most of our time, looking straight ahead, scanning for danger. We want to let the eyes go out into the periphery, but not so much that you feel a strain or a stretch. So make sure that when you do this exercise, you're not looking so far that it feels like it's irritating to your nervous system. You're not going to get a phase shift if you're overstressing or stretching the nervous system in that way. And the third is, don't stay longer than a minute. If it doesn't happen for you in a minute, just move on with your life. Go to the other direction with your eyes, wait a minute. If it doesn't happen, just go on with your day. And then the next time, maybe an hour or so later, you can try again. For some people, they practice this for up to 2 weeks before actually getting a significant response. And some people, it's quite instant. You may find over time that you're kind of like a yawner, or your body salivates, or you swallow, or so on. You might have sort of a stereotypical way that your system tends to respond to the exercise. And the cool thing is, once you begin to initiate that phase shift, it becomes more and more automatic and easy for your nervous system to access and find in the future. So if you're looking for support of your vagal tone, if you're curious if you have a vagal tone issue, we have many ways to test, screen for, and then of course treat vagus nerve dysfunction, which can improve your quality of life on many, many levels from many, many perspectives. So do reach out. I do free 15-minute consults, and I would be happy to support you.